so much for taking the time to spend with us in Healthy Talks and share your knowledge across the nursing and healthcare professional industry.
Thank you for having me.
So, Cathy, your journey into nursing began with a desire to make a difference in people's lives. Can you share a specific moment or experience that solidified your decision to pursue nursing, especially in long-term care, and how it has shaped your career path since then?
I was very fortunate to have some great mentors and some great experiences throughout my healthcare, but I do remember a couple of scenarios when I was in long-term care, and I got to meet what you would consider a younger type person who had Lou Gehrig's disease. And if you know Lou Gehrig's disease, it definitely hits you when you could be younger, but you still have full mind capacity in that. So her body was failing, but her mind was still working. And I definitely remembered we did form, in regards to being able to talk, and I cared for her on a regular basis, but I was able to even take her outside of the long-term care place and take her to the movies and take her to lunch and do some things that she may not have had an opportunity to do after that. And I had another patient as I moved into the hospital, where I had a patient who went into some kidney failure. And I really, getting to spend a longer period of time with them, got to know their family, and the impact that it was having on them in regards to physically, but also emotionally, what they were going through. And it definitely made me want to make that type of a difference. If I can even make an experience that they're going through that is very difficult, less emotionally or physically, in any way that I could help them, I wanted to do so.
Cathy, I commend you for that. That's very beautiful. So, starting as a certified assistant and transitioning to a registered nurse, you've gained valuable experience across various healthcare settings, including acute care, critical care, and medical staffing. How have these diverse roles influenced your perspective on patient care and nursing profession as a whole?
I've been very fortunate. I started from the ground up, and I think that it really helped me respect everybody who plays a part in that care. So it's not just the nurse, even though the nurse plays a big role, but it is the CNAs, it is the allied health professionals behind the scenes. It's everybody who actually has an impact on the care that is being given. So I'm very fortunate. I started as a CNA, then I was a CMT who passed meds, and then registered nurse working in med surg, step down, ICU, not all the other areas, but I think it definitely gave me an appreciation for the whole healthcare system and the part everybody has to play in it, because it does take a team to be able to provide that care. It's not just one individual.
And Cathy, like you say, the appreciation it's given you, I think everyone's appreciating everything you've done in that community. And again, I commend you for that. So, Cathy, your focus on keeping nurses in nursing by providing career variety is commendable. Could you elaborate on the importance of offering diverse opportunities within the nursing field, and how does that contribute to the retention and satisfaction of healthcare professionals?
Sure. And that is actually extremely important to me. And that is really what drives me and keeps me going. Nurses, if you talk to a lot of nurses and even other allied health professionals, they enter it as a career. So it's not just that job. They're going to keep doing that for the rest of their life. And they're not going to keep doing that same job day after day after day. So you have to be able to provide alternate opportunities for them to be able to grow professionally, but also the flexibility that as their life or their personal life makes a change, that you have work that will help them continue in their profession. So that's why I think it's important to have acute care opportunities, but maybe even school nurse opportunities, home health type opportunities, because again, they change. You don't want to keep doing the same thing most times for the rest of your whole life. Because if you look at nurses, their careers are usually 30 to 40 years. So you want to be able to offer variety for them. And sometimes as the nurses then start taking on a family, they may not be able to work full time, or they may not be able to work the night shifts or the day shifts. So you need to have evenings or nights or part-time work or per diem type work. So I think healthcare offers a very unique opportunity that allows for a wide variation of opportunities and flexibility for healthcare workers. And I think it's extremely important because we have a shortage of healthcare workers. So anything we could do to keep them in healthcare, as we bring in more new people, they need to be able to leverage off the people who have that experience also. So it allows that.
All right, that makes a lot of sense. So as a contracted service provider, what strategies or initiatives have you implemented to create additional opportunities for nurses and enhance patient care outcomes within your scope of practice?
I think some things that I'm kind of proud on is in regards to when disasters or some things have occurred. I think I have been one of the providers that did provide that type of service when it first started. So if there was a hurricane or if there was a tornado or whatever, I have been able to create programs that provided immediate assistance to those different types of opportunities. But I also think I'm a never say never type person. So if somebody does tell me about a staffing need that they do have, there is usually somebody who will be able to do that. But I would have to say doing some rapid response or some crisis type staffing has been something that I was probably one of the people who were at the forefront of creating that type of opportunity for healthcare workers. But another area is that, many times nurses are being interviewed or need little bits of training along the way. And I have actually utilized nurses that needed more flexibility or wanted to make additional income during that time to be able to do some things that might be outside of what they were doing. So I always try to create unique types of opportunities or situations. And again, that might be a nurse who's working full time but wants to make some additional money, as a lot of nurses do that, healthcare workers do that. So I have created some positions to also do some alternative type of clinical experience.
That's amazing, Cathy. Sorry, I didn't even know you were so depth in that. That is something so different, and I think the viewers alone will appreciate all of that you've done. That is amazing. Telehealth is becoming increasingly prevalent in healthcare delivery. How do you see telehealth transforming the nursing profession, and what steps can nurses take to adapt to this evolving landscape while maintaining quality patient care?
That's a great question. And that is definitely an evolving area. I think we are already seeing some of the telehealth. Some telehealth has been around for a little while, like especially helping the rural areas where you might have a urban type area, like in St. Louis. There's a healthcare system that provides telehealth to some rural hospitals in regards to their ICU. So you might have a center that is monitoring patients that might be in another city or area that is helping to provide additional care. And I think that will continue to grow, especially in the rural areas. But another area that we're seeing a lot is that telehealth for admissions to help the nurse, because the nurse is already caring for quite a few patients, but also getting admissions during the same time. And you are seeing some telehealth being used for that service to help do the admissions for the nurse so that they can just move forward versus doing that too. But you are going to see more telehealth come about. Nurses are going to have to be extremely flexible, agile, but they're going to have to be a part of that initiative, because the expertise that's going to be drawn from are going to be from the nurses who are currently providing that skill now. That will have to be parlayed over so that all the information is captured and we don't lose what we are doing really well. And that is the patient experience. We don't want to impact negatively the patient experience or outcomes. So I think it's going to be critical to collaborate with the nurses who are currently performing those same roles and functions. And I do think AI is going to be playing some part into some of this, and it's going to continue to evolve. And it's not just going to be in nursing. I think telehealth will also be introduced to some of the other areas that are in healthcare, especially in the laboratory or in the pharmacy. You're going to start seeing some other telehealth happening. And I know during COVID, we also saw quite a bit of telehealth occurring outside of the hospital. The areas I just spoke about were within the hospital. Outside of the hospital, we're already seeing quite a bit of telehealth, and we're going to see that grow, especially as there is such a shortage of physicians. And I think it might branch over into some of the home care, which is also growing faster, possibly than the supply of personnel to provide the services.
Thank you, Cathy. I think the viewers will agree that was very informative, and I think they would have enjoyed all the information that you've just given them. Improving patient care is a big thing I hear in everything you are saying, and I believe that is what everyone wants to push at Green Staff Medical.
I agree.
With patient advocacy is the cornerstone of your work, how do you prioritize advocating for patients' needs and rights in your role? And what impact do you believe patient advocacy has in improving overall healthcare outcomes?
Patient advocacy is critical. And yet it's so hard because you're trying to make sure you have enough staff and everything. But I feel that's why I do what I do. Helping to get more nurses and allied healthcare people in the hospital helps patients be seen, be heard. Otherwise, you're just providing the care and trying to get done what you need to do. But to be an advocate, we need to be listening to what they are saying, what they need. But I think that it is listening. I know we do quite a few surveys. We get a lot of feedback from our facilities. I think that the advocacy is also a collaboration that we have with the healthcare organizations that we work with. Because what we're doing right now, we're hearing it, but it might be secondhand from our staff. I do think it's collaborations with the facilities that we work with and hearing, aligning to what they're trying to do. But it is continuing to provide staff. It's also keeping up with what is going on in the communities, the clientele that they are servicing, the needs of that community and of that patient.
Brilliant. You've mentioned that the potential for your consolidation in healthcare. How do you envision this trend affecting nurses and healthcare workers? And what opportunities or challenges do you anticipate in this evolving healthcare landscape?
That's a good question. We're already starting to see a little bit of that consolidation in regards to hospital systems getting bigger and joining together with other organizations. I think some of the opportunity will be for career advancement for the healthcare worker because they're going to have more opportunities, more resources to grow within an organization as they will need more leaders. They'll need more positions in regards to not just the staff nurse or the allied member, but they're going to need managers, they're going to need trainers, they're going to need preceptors. So it will provide more opportunities for professional growth and development. I also feel that it will allow for people to diversify in regards to if a med-surg nurse wants to work in ICU or work in ER or work in another area, move to home health or move to another area. There'll be more of those kind of opportunities. On the other side, though, they'll have less choices in regards to hospital systems to apply to. There'll only be a certain number of employers that they can apply or work within. So less numbers of employers to work within, but more opportunity for professional growth.
Okay. Cathy, if I may ask, what is a message or anything you would want to say to anyone looking to get into the healthcare, becoming a healthcare professional, or is currently a healthcare professional that is having a bit of issues or struggles out there? What are the messages you would want to give them?
The first thing I'm going to say is don't give up. Find a mentor. Find somebody that they can talk to. But I think the biggest thing is to look at where they want to go. There's so many different areas. They may not like what they're doing currently. That's one thing in healthcare that you don't see in so many other careers and opportunities. In regards to engineering, they learn how to do one type of engineering. As a nurse, you learn core competencies and skill sets and things, but then you can use those and move into other areas. If you don't like working in the OR, maybe you might want to work in pre-op or post-op, or, there might be other things. You may want to work outpatient versus inpatient. So I would not give up. You may want to go to a part-time position versus a full-time position. You may want to change your shift up in regards to what shift you're working. And again, that's the opportunity within healthcare, is you're not just stuck in one specific career path. There's so many other things you can do. Even within nursing, I mentioned that I started as a CNA and then a CMT. I am a registered nurse, but you can move on to be a nurse practitioner, a CRNRA. There are other things that you can do in regards to that.
Thank you, Cathy. Thank you for that. And thank you again.
Can I say one more thing too? And I apologize.
Go for it, Cathy. Go for it. No problem.
Else. I just talked about changing what you're currently doing, but I also want to address the potential burnout or the stress that the healthcare worker is experiencing right now. And that's not going to go away. And we do need to address it. We do need to acknowledge it, and we do need to provide resources for that person to go to. And that might be within your employer. It might be within your own healthcare that you have within yourself. It may be other things that you need to do in regards to hobbies or exercise or whatever, but you do need to acknowledge it, and we do need to address it.
Cathy, thank you so much for that, and thank you for addressing that. And I believe that is a big thing, burnout, for all healthcare professionals. And thank you for that. And as you guys hear from Cathy, seek that help, whether it be with yourself, within your healthcare facility that you're working at. I believe it's a big thing. And there are places like that you can reach out. You speak to people at Green Staff Medical. They can assist you. They can help you, I believe. And Cathy being one of them. And again, Cathy, thank you so much for taking the time and just speaking to us today on HealthETalks. And if the viewers out there want to reach out to us, our contacts are in the links below. Please feel free to link out. Please subscribe. Please like. It does help the channel grow. Thank you for everything. And Cathy, again, thank you so much for taking the time.
And thank each and every one of you. I think we're all so grateful to have all of you out there doing what you're doing each and every day, and try to get more people like you to come join us.
Thank you, Cathy. Have a great day.
You too. Bye-bye.